Your mouth
100%.
has to be healthy for your whole body to be healthy.
100%.
How does that work?
In terms of overall health, we try to educate the patients a lot. We tell them that everything starts in the mouth. That's where you start chewing, and then it goes everywhere. So patients who have a lot of plaque accumulation, who don't floss, all of that is just bacteria. And when you're swallowing and chewing, it's just going into your body. So it has a lot of different aspects that it involves. Like patients with bacteria and periodontal disease are 5 times more likely to have diabetes, heart conditions.
And we actually have a graphic to show our viewers
Yes,
that you're
I would love
exactly
to.
talking about this.
Definitely.
So your overall health is important with your mouth because look at the things it could cause in your life.
Exactly.
Endocarditis, what is that?
So endocarditis is basically an infection that occurs, let me show you over here, it occurs in the heart. Basically, when you have a lot of inflammation and bacteria, a lot of times you'll see this when you're having like dental procedures or other procedures done. That bacteria goes into the bloodstream and it attacks certain parts of the heart. And so a lot of the times when patients come in with a lot of bacteria, we'll try to what's called pre-medicate them. So we'll give them antibiotics and we'll try to prevent this endocarditis. So it's a really aggressive infection of the heart.
And doctor, now that you're there, could you explain a little bit about the anatomy of a tooth? I'm just always fascinated.
I
think
love
they're
that.
just fantastic.
Yes, and I actually do this diagram at my office a lot. So when I show x-rays to the patient, I bring up x-rays and I have like a little chart just like this because I feel like it really helps to identify. So what I explain to my patients is that the teeth have 3 main features. One of them would be here. So this is the nerve of the tooth. We call it the pulp, and that's what gives the tooth life. It helps, that's where you feel pain. Other than that, then we'll have the inside part of the tooth, which is called the dentin. That's the yellow part, the inside part of the tooth. And then we have the white part, which is what we all smile with, and that's called enamel. So if you think of the enamel, it's kind of like thinking of the shell of an egg. It's the strongest part of the strongest bone in the body, actually.
It's stronger than our bones?
Stronger than our bones.
Wow. Okay,
Stronger
continue,
than our
doctor.
bones.
I'm sorry.
So basically, those are the 3 anatomical features. And what happens is, most of the time when you start getting cavities and you're not a big flosser, you start developing cavities right around this area, because right around here is where you would start flossing. So patients who don't really floss would start getting cavities here. And as they start passing kind of this line right here where the enamel goes into the dentin, the cavity starts getting bigger and bigger, and it starts to attack the nerve.